The consumer side really trained us to just want access immediately.
The goal of e-commerce, the goal of direct-to-consumer is to actually eliminate administrative tasks. How do we ensure that accessing the healthcare that we need, specifically getting the medications that we need, is as simple and as straightforward as getting anything else that we need in our life.
But there's no question that people want this information, and they're going to try to access it in whatever form it's available.
We would live in a world where going physically to your doctor's office is not the only way to access healthcare anymore. After the COVID-19 pandemic, it became really popular to go online or find different avenues to try and access healthcare. We now live fully in that world, and today we're going to break down all the ways that you can get access to healthcare.
Have questions about your healthcare and not sure where to turn? We give you unfiltered insight into how healthcare really works. This is Give It To Me Straight, Doc, presented by Tampa General Hospital and our partners at USF Health Morsani College of Medicine.
Welcome, everyone. You're watching Give It To Me Straight, Doc. I'm your host, Anjali Kimlani. Today, we're digging into DTC, direct consumer healthcare. It's a very popular way for folks to access healthcare. You might have done it once or twice using a telehealth platform and the like, but there's also been retail avenues in as well. And to help me understand the whole industry and how it all intersects is none other than Amazon One Medical's Chief Medical Officer, Andrew Diamond. Andrew, thank you so much for joining us today.
Thanks so much for having me, Anjali. Great to be here.
So Amazon is partly to blame for us wanting this, right? Amazon, the consumer side, really trained us to just want access immediately for anything. And that has bled into healthcare recently. I wonder if you could just take 2 seconds and break down sort of this direct consumer thought process of how to deliver healthcare.
Well, what it really comes down to is the idea of going outside of your regular insurance offering and, going through, if you want your insurance to pay for your doctor's visit, you're going to need to see a doctor who is in network with your insurance plan. And you ultimately may be going in for a visit that is more wide-reaching than what you really need solved in that moment. And the idea of direct-to-consumer DTC healthcare is, it's often referred to as sort of a point solution for your specific medical issue that lets you sort of get in and out and pay cash for a service that can be rendered online or through some other virtual system, even potentially over the phone. And you're just paying a single cash payment, or in some cases, a subscription to get usually a specific medication or a specific set of medications for a medical problem without going through your insurance at all.
And this has become increasingly popular because we like online shopping. And so it just puts healthcare right in the path of patients, right in the path of consumers. I like to joke that the entire healthcare industry decided that patients were consumers without telling them. But then we've shifted to a world where patients know they're consumers now, or at least are acting like them, and are asking for, healthcare options to kind of be delivered that way. There's so many, we've talked, on this show about mail order and online pharmacy options. And there's also, the telehealth platforms and finding connected systems, right? The way that you operate, say, with a telehealth platform connected to a drug dispensing or drug coupon platform, and then get access that way. So there seems to be a lot of intersections now. And I know, Amazon has obviously thought about this, and there are ways that they're sort of working and progressing on that. Tell me about sort of One Medical right now serving in a retail way, in a subscription model, at a time where we've seen the closures of some clinics like Walmart, notably. There were other avenues for patients, but those have kind of gone away. How does that physical footprint operation still make sense today? And what are you seeing in terms of traffic that tells you what patients need in those physical locations?
Well, there's a lot to unpack there. Let me just start by saying—
Easy questions only here, don't you know?
Well, Amazon is really all about offering people choice and helping to curate that choice and helping people sort of understand what it is that they're really looking for and giving them a range of options. One Medical, which has been around since 2007 and has been under the auspices of Amazon since 2022, was also created with the idea of sort of meeting people who need healthcare where they are. When we started in 2007, it was an in-person operation. We were opening medical offices, but we were opening them in convenient locations, downtown, like near where you work, or in a mall where you live and shop. So the whole idea was to be much more convenient than and accessible than a typical doctor's office. And as the years have gone by, we've added at One Medical lots of options for getting care virtually. When we started, it was all about going through your insurance so that you didn't have the added hassles of other out-of-pocket costs. But with the passage of time and with the rise of a lot of direct-to-consumer options, as we were just talking about, One Medical, as part of Amazon, has added lots of DTC options. So when people come in the so-called digital front door of Amazon with some sort of health intent, thinking, I would like to get this ache or this pain addressed. Maybe they're shopping for a splint or for a supplement or a vitamin, or maybe they're actually trying to get their diabetes under control. Maybe they're shopping for a glucometer or a infusion pump. Maybe they're just shopping for a scale. Maybe they really don't know what they have and they're coming in and using Health AI, which sits inside of the Amazon website, to just get a very general medical question answered, saying these
And
are the
that's
symptoms that I've
increasingly
been having.
used, right? AI and searching for answers to what I feel right now. I mean, that kind of tells you a little bit about where we are, where patients no longer care about the privacy. They may or may not know that their data is being used that way, and they may or may not understand that. But we are in a world where putting anything into a search engine or even into, an AI platform, I don't think that there is that concern anymore about, oh, what will happen if it gets out that I'm searching for these symptoms. I think that's sort of where the consumerism part is open. When One Medical started building out these locations, right, back in 2007 and onwards, part of it was in partnership with hospitals. The way I understand the relationship to work is that hospitals kind of take on, the responsibility of building out these physical footprints, and then One Medical comes in to put the sign on the door. And so with that, you're sort of plugging into the existing system. That's really different than what telehealth does, where it's very separate. And so I wonder if you can explain sort of why there are limitations in some instances to, one online platforms versus those that have in person, because there are just some things that online can't handle, right?
That's right. Let me actually very quickly touch on the issue of privacy and safety and security of data that people are putting into health AI or any digital experience. I think it's really important to note, you're right, that many patients, many consumers of healthcare are increasingly okay with the idea of putting their confidential health information into an online system. But I think it's really important to note that Health AI, which is Amazon One Medical's offering, is entirely HIPAA compliant, and information that people put into Health AI is treated as extremely private and secure health information according to HIPAA.
Sure. No. I'm not saying that.
So
I'm not saying
is
that any of these platforms aren't treating that way. Every single platform has said the same thing. You have to, and because the laws are. I'm just saying the idea that, people are even using like search engines and the like, right? So, but continue.
fair point. Well, so back to your question about how One Medical integrates with health systems. Actually, what One Medical has done for the last 8 years is around the country partner with world-class health systems like Mass General Brigham, like Duke, like Emory, like UCSD and UCSF and Rush, and I could go on and on.
Yeah.
Cleveland Clinic most recently, where we open primary care clinics in affiliation with those health systems so that when our patients are in need of specialty care or hospital-based care, they have great access to some of those world-leading specialists at those great facilities. we as a primary care organization view our role as trying to handle healthcare as comprehensively as possible. When you come to One Medical, whether you're coming in a DTC kind of environment to get quick care for a specific condition, or if you're coming in as a patient who's looking for longitudinal primary care, or you're somebody with a complex illness who's looking for primary care as well as specialty care, we're trying to handle as much of that as we can for you to make that as easy and as convenient for you as we possibly can. And ultimately, if you do end up needing a specialist, to make that connection happen as seamlessly as possible. That's really complicated. I mean, it requires expertise in technology, in the operations of primary care, in making sure that our clinicians are trained comprehensively and are able to deal with a wide range of problems, and building all of these partnerships with these fantastic institutions around the country. But pulling that all together is how we deliver really high quality, high value care to our patients, our customers, our members.
No, absolutely. I think closing that, making it a full circle is definitely the way that we have to think about, because right now a lot of online options are pretty disparate and patients are falling in the gaps. But that's all the time we have for today. Chief Medical Officer of Amazon Health, One Medical, Andrew Diamond, thank you for joining us. Don't go anywhere. More DTC, that's direct to consumers options, coming right up. Welcome back to the show. I'm your host, Anjali Kimlani. We've been talking about direct-to-consumer, that's DTC care. It's a type of care you get online, really easy. We know we're in a world full of it. And to help talk more about it, I've got with me Michael Botta, who is the president and co-founder of Sesame. Michael, thank you so much for joining us today.
Well, thank you very much for having me.
So, Mike, I want to talk about this. Sesame is one of many platforms that are out there right now. We live in a world where you can basically get whatever you want, mostly generic or brand prescription drugs that are widely available through online platforms in partnership with telehealth to make sure that doctors are still part of this conversation. But the way that you're operating right now, I think it's an interesting world where many folks are very comfortable getting into this space because we're used to, online retail. What can you tell us about what you're noticing about the way that customers come to you, the avenues with which they come to you, and what they're really looking for?
Yeah, and one interesting note there is that wasn't always true. We started this business in 2017, launched in 2018, and started really with a focus on brick and mortar care, so navigating patients to seeing a doctor in person. And then there was this global pandemic. You guys might have heard of it. I don't know if it crossed your radar.
Really?
But,
tell me more.
Yeah. So everything sort of became online by default, especially healthcare, where there was concern about going to a site that would be a vector for infection if you didn't have COVID. So if you needed refills or just a consult with a doctor for something other than infectious disease, all of a sudden telehealth became dominant. And there were two other things happening in parallel. So you had the launch of these direct-to-consumer models that were really focused on generic drugs that you wanted to receive discreetly, let's say, to get mailed to your house. So typically that was, ED medications, hair loss medications. You had all of these models that sprung up that were saying, look, we will take care of this for you. You don't have to talk to your regular doctor about this. We'll mail them to your house every month. And that spawned some very large companies, like Hims, Ro, several others. What has happened more and more, though, is there are lots of Americans who don't have a regular doctor anymore. It's actually increasingly uncommon to have your own brick and mortar primary care doctor. And so B, people got more comfortable with the idea of using telehealth as just a modality to see a doctor, not as its own thing that has to be kept in its separate box, but just another way to engage with the healthcare system. And I think that's really what we do at Sesame, is sort of connect you to real doctors that you choose yourself. You pick a doctor from the platform and then see them on telehealth, just like you were seeing them in person in an office, for a much wider range of conditions than just the ED, hair loss, or sort of the telehealth 1.0 models that we saw in direct-to-consumer.
But there are still limitations to that, right? I think we've started to understand that you still do need some sort of physical care and being able to go into a hospital or into an outpatient center for more acute care. But increasingly, especially because it's impossible to get a primary care appointment for months. I mean, I know that's one of the major complaints. So this sort of helps bypass that backlog.
So for sure, right? Like this is not going to replace an ambulance ride to the hospital. It's not going to replace lots of things that require in-person care, emergency care, you name it. But I think what people are realizing is this is a great complement to in-person care. You might see a clinician in the brick and mortar setting for an initial visit and then follow up with them on telehealth or vice versa. Also, you can disaggregate the things that have to happen in person versus the things that can happen via telehealth. So we just launched this fertility program with Costco on Sesame. And there's lots of in-person care involved in fertility, but that doesn't necessarily mean you have to start there. So if somebody starts on Sesame and then gets labs ordered and diagnostics ordered, obviously they're going in person to have blood drawn or for an ultrasound, but then those results can get transmitted electronically. They can follow up and discuss the results with their doctor online. So what we're seeing is you can take the various parts of your medical journey and do the parts in person that have to happen in person, do some parts that might be more convenient via telehealth, which makes a huge difference if you don't, like I'm sitting in Manhattan, so I can see, probably 50 doctors if I look out the window, but that's not true everywhere. So being able to do that without having to drive, without having to wait on a long, waiting list to get in, can make care more accessible. And fundamentally, I think that's been exciting for a lot of people.
And you've chosen a really interesting avenue, partnering with Costco that gives you access to their entire membership. What have you noticed? What are some of the trends you've noticed either post-COVID or just broadly, since launching about where the core market is for you and what that tells you about what the needs are in America's healthcare system?
Yeah, so when we started, I think we had this thesis that there was going to be more care that sort of falls in the chasm between things that your health insurance pays for and things that are viewed as like preventive or lifestyle medicine. And boy, GLP-1s, weight loss medications are a perfect example of that. And there is just massive organic demand from Americans saying, look, it turns out my insurance doesn't pay for this, but I want it anyway. And I'm used to spending money on weight loss. I have a gym membership. Maybe I paid for Weight Loss Watchers or all kinds of things historically, because weight loss in America is an $80 billion consumer industry. And so the idea of paying cash for weight loss care isn't foreign to people. It's just this is relatively novel in that it's prescribed medication. It's not a mindful eating program. It's not a calorie counting program. It's something different. So we've seen tons of demand, whether it's from Costco members or non-Costco members, for things in that category. And I think that is the start of something. It's not going to be limited to GLP-1s, but there are many more therapeutics coming down the line where insurers are saying, look, this is kind of preventive care or lifestyle care. It's not the kind of thing that your health insurance is going to pay for. So you can pay for it yourself. And there's real demand to pay for it because it actually does something of value. The other thing where we've seen a lot of demand over the last couple of years in particular, more Americans have health insurance, but health insurance is less generous.
Yeah.
So it might have a higher deductible, might have a higher copay. You see more people moving into, what I will call defined contribution plans as opposed to defined benefits. If you think about how people used to have pensions and now have 401ks,
Right.
Something similar is happening in health insurance benefits, where you used to have guaranteed health insurance. Now you might have something called an ICHRA plan, where you just get money and it's up to you to use that money to pay for health insurance or something else. And as that's happening, we see more things where patients realize, turns out if I just pay the cash price for this, it's cheaper than going through my
Oh my
insurance.
gosh, I know. I have this thesis that if anyone who is, healthier and can actually tolerate it, they might be able to just get a much cheaper healthcare program for themselves if they sort of piecemeal direct-to-consumer platforms and subscription platforms and the like. Seems like that's definitely a popular theory out there.
More people are doing it. I think what we find is people are better informed because of things like AI.
I was going to say
And
AI.
yeah,
It's easier to find information. It's easier for patients to find you and your platform and others like it because we're all living in that world now. We're no longer, sort of just looking on for appointments or looking for certain things. There's a whole world out there to really engage in. Well, Mike.
and that's true. On the one hand, have been historically waiting longer to see a doctor and sort of are more eager to get healthcare information that can be harder to find from a physician. But on the other hand, they now have access to a lot more medical information via, Claude, ChatGPT, et
Right,
cetera.
and all
And we
those.
can debate whether that's good or bad, how accurate it is. Should you be using something more like open evidence and things to come versus those models? But there's no question that people want this information and they're going to try to access it in whatever form it's available.
Yep, we're in a consumer world, that's for sure. Michael Botta, president and co-founder of Sesame, thank you so much for joining us again today. Don't go anywhere. More DTC, that's direct to consumers options, coming right up. Welcome back to Give It To Me Straight Doc. I'm your host, Anjali Kemlani. We've been talking all about direct-to-consumer DTC care. Hopefully you understand and know that acronym now. And we have so many different players catering to different needs for direct-to-consumer. And direct-to-consumer basically meaning direct-to-patient, right, Laura? We've got
That's correct.
Laura Jensen on with us, Chief Commercial Officer of GoodRx. Thank you so much for joining us today.
Thank you for having me.
So you've been in this world for quite some time. Prior to GoodRx, you were also with Amazon, and I joked earlier in the show that they're sort of to blame for why we even have this need. We as consumers, as patients, just want things on demand, and the traditional healthcare system not so much ready for that. It is a little bit slower. It requires a lot more manual labor to get things done. Meanwhile, we've got the technology to kind of support, and increasingly so with AI, to support more healthcare through tech platforms. I think it's really interesting to think about what that means for the future, because there are still areas we've established that, healthcare will stay manual and will stay physical, but there are opportunities. Talk to me about, from your vantage point, where you see the movement going, especially for access to drugs in particular. I know there's been some differentiation between generics and brand. There are some brand prescriptions available, but it's largely been generics till now. What does that tell us about the health system and what we need to sort of create better navigation for it?
Yeah, it's a great question. I would say that the evolution of direct-to-consumer healthcare with regard to how patients essentially shop for pharmaceuticals or for any type of healthcare online, we're still kind of in the early innings of that, even though Amazon acquired PillPack nearly 8 years ago. And so, I think from my vantage point, I came from the pharmaceutical industry. I spent my career in pharmaceuticals. And early on, before I joined the PillPack organization, as you alluded to, being part of Amazon, the thesis was, what does it mean for e-commerce to come to the pharmaceutical industry? What does it mean ultimately for e-commerce to sort of live out the full value of what e-commerce has done for every other industry that came before it? And really what it's done is it immediately expands the scope of what customers expect from their experience. It elevates, really the expectation of the consumer experience out of the gate. It creates typically a shorter, stronger supply chain, and it prioritizes price transparency and choice. It also means that geographic limitations really no longer exist in the way that they traditionally have. And so I really couldn't have thought of at the time, and still can't think of, an industry that's more ripe for the opportunity to deliver that type of experience at scale. And so, I think when we think about parts of the healthcare system that can be served really well, it is the drug supply chain, because that is a place where when we think about sort of what we put in the administrative portion of our overall healthcare experience. A lot of times, for example, when drug companies talk about patient engagement, often they're talking about engaging a patient to do an administrative task. And I think the goal of e-commerce, the goal of direct to consumer is to actually eliminate administrative tasks,
What do you mean by
allow for
that? What do you mean by the administrative tasks? Give us an
well,
example.
things like, managing, going into a pharmacy and having to physically manage that experience, having to make sure that you're calling your healthcare provider to ensure that your prescription was sent over appropriately, to make sure that, you have your credit card, that you have, all the things that you need to transact with your insurance card, and that you're really not able to do that in a way that we traditionally buy, services and goods online. For example, I don't know about you, but if I'm shopping on Instagram, if I have to put in my credit card,
Oh,
I will not
immediately.
buy something. Like
Why are we
the
so
standard,
lazy now as a society? But no, but it's that mental burden of having to go through the steps.
it's so true. So that's what I mean by administrative burden. It's, how do we ensure that, accessing the healthcare that we need, specifically getting the medications that we need, is as simple and as straightforward as getting anything else that we need in our life. And really until now, the technology, the transparency, the infrastructure really hasn't existed. And frankly, from a drug company perspective, the orientation for those companies was not around direct to consumer customer acquisition in the past. So now all of these things are converging with GLP-1s, with patients shouldering more of their healthcare dollars than they ever have. The time is now really for this to take shape.
And it also gives the opportunity, at least in theory, to lower costs, right? We know that GoodRx has been on the scene for that for some time, giving opportunity, backing the TrumpRx platform as well, and giving access to lower pricing. I think what's really interesting about that is that drug companies, to your point, are now jumping in on it. We've seen Lilly and Pfizer in particular, Novo as well, launch their own sites, partnering with telehealth to do so. So what do we know about that, about the willingness of a patient to spend out of pocket, the prevalence of generic drugs in America and the 90% fill numbers for that versus brand, and sort of where there is opportunity to then pull down the cost? Because I think the criticism has been that it's been largely in areas where the prices are already low. We saw that sort of discrepancy over the TrumpRx thing as well. So talk to me about that, because I know you guys are behind that.
Yeah, so I think, if we were to line up, let's say, a place in the pharmaceutical industry where patients have the highest degree of friction, it's going to be on brands, right? That's where prior authorizations exist. That's where, copays really come into view. It's also a place where, as we see, where innovation has happened in the pharmaceutical industry, specifically around GLP-1s for the treatment of obesity, where we have not seen formulary access expand. In fact, we've seen the opposite. It's contracted. And so when we think about the opportunity to create a direct-to-consumer environment where patients understand their options from a price perspective, they can have a more educated conversation with their healthcare provider about those options and what price means for them, whether that's their cash price or whether it's a covered claim and they're using their insurance and they're just paying their copay. But you mentioned, how Amazon really taught us how to shop online, created that expectation for us. GLP-1s has taught patients how to shop for pharmaceuticals online. And so really the opportunity for GLP-1s to deliver an experience that I think all of us are very much asking, is that scalable to the rest of healthcare? Because as we think about new drugs coming to market, as we think about new opportunities, not just the Eli Lillys and the Novo Nordisks of the world are asking themselves, can I build a Lilly Direct myself? Should I be building a Lilly Direct myself? And I think a couple of things on the topic of drug manufacturers kind of getting into this, them building a storefront for their brand's space. It's wonderful that there's an orientation from pharma around what direct-to-consumer means and reframing what their role is in the life of patients as a more traditional retailer. I mean, that's really what we're talking about. But I will say that as we fast forward here, we look around the corner to an environment where there are multiple GLP-1s, where there are potential more opportunities for different type of pricing models, as we announced our employer direct model a few weeks ago. Fragmentation will continue to be an issue. We're just kind of trading one problem for another, and that patients are now confused, about their insurance coverage. Are we just trading that for a more fragmented environment where drug companies now require that you go to their website to get their medication directly? And so that's really where a company like GoodRx steps in and says, we can be that marketplace that allows pharmaceutical manufacturers to reach patients directly, that provides clarity and choice and options for patients while leveraging the existing pharmacy infrastructure of 70,000 pharmacies where patients are already getting their care.
Oh man, you and I are on the same wavelength. I've been saying that it's a great idea for the drug companies to do it, but it's like going to the manufacturer of a TV company. Like, you're not buying it from that. They have it available, but how many sales are they actually making versus any sort of intermediary? So that's really interesting. Unfortunately, we have to leave it there, Laura, but I am so glad that we had you on. Laura Jensen, Chief Commercial Officer of GoodRx. Thank you for joining us.
Thanks for having me.
Thanks so much for joining and watching today. Hopefully you learned a little something about direct-to-consumer healthcare. I've been your host, Anjali Khemlani. You've been watching Give It To Me Straight Doc, and we're here to hear from you. If you have a medical question you've been unsure about, ask us. We feature real questions from real people on the pod. Don't forget to scan the QR code on your screen and join us next time.